if people continue to lie or cheat, their career is going to be short-lived because people is going to find it and you're going to block your own career.
Meet Professor Hom-Lay Wang, an internationally recognized leader in periodontology and implant dentistry. A respected educator, researcher, and clinician, Professor Wang has shaped modern periodontal practice through decades of academic leadership and global influence.
How do you control the technology?
Understand what's the limitation of the technology. That's what control it. The young people totally 100% believe in technology, which is a problem too.
While you do use a certain technique to treat the patient.
Kind of advise the young people, what lasts long is not a technique, it's the science foundation.
Due to social media, they compare teeth to implants and some say implants are better than teeth. What's that myth for the public and for dentists? What do you think?
Because I see many social media is fake.
Yes.
So unfortunately, that's the way they do. They post the areas and this is right after surgery. But did they ever post 2 years after? They don't. Because the consequence is that the things does not work. Look good does not mean they last longer.
What do you see in the future now?
I think the future technology is going to...
Welcome, Professor Wang. It is such an honor. And I think this is one of those dreams come true, especially on our podcast. You are the periodontist in our current generation and the educator in the #1 ranking school, University of Michigan Dental School. And it's probably because of all your publications that you have been one of the best educator in our generation, especially in periodontics. So it's such an honor to have you with me here today on our podcast. I don't think you need an introduction of yourself. We all know what you have done, and a lot of us respect you. And I want to share a small little story of how I've known you 17, 18 years ago when I took my American board exams. And you were one of those that were on my board examiners. And all of us know when we study and we have to take our vivas, we will all get very nervous. And if Prof Wang's name as an examiner, it's on the board, we know, oh my God, we're all probably going to fail. That was the first thing. Mm-hmm. I saw your name, I'm going, oh, I'm dead this time. But you were so gracious at the board meeting and you were very strict. You asked a lot of questions and I just, and I passed somehow or another. And from then onwards, I had a very different impression of you. So I don't know how you do it. You have inspired so many people in our industry. What do you think is the core that brought you into education to groom so many of us in the world now? And many of them are superstars and influencers, inspiring periodontists and clinicians that shake our industry. Yeah.
So, Jeanette, thanks very much for having me. And it's good to see you here and also get a chance to talk to the audience a little bit. You know, one thing I always think in my life, what is most important, which is impact on my life is I believe in the things people talk to me. He said, the most important things in your life is not how many things you obtained for yourself, but it's how many lives you have changed. Mm-hmm. So with that, my goal is not always making a lot of money, but it's how many people I can change. And I remember one of my faculty told me, he said, if you are in a private practice, you have 2 hands. You can only help one patient at one time. Mm. But if you are educator, you can share your knowledge, your skill with many people. Mm. So through your the people who take your course or who you train, they can serve more patients. So instead of treating one patient, you are now treating 100, 1,000 or 10,000. So you can actually impact more and to help more people who needs your help, who needs the dentist in terms of to bring them to what they want. So I always believe, as an educator, we can impact not only on couple of your students' life, but also impact on people who entrust us, which is a patient. Yes. And that's important.
That's true. No, but that's so inspiring because there are many educators around the world, but not many can be number one. And I think you are truly the number one with, I think, 800 scientific articles being published. I don't know how you even use your time because most people, that's 3 lifetime of publication that you have achieved and, done. And of course, 3 textbooks and many, many more. How do you organize yourself to even do so much?
One thing is I think one person cannot achieve everything. So I don't want to say I'm a number one. And I'm saying I have a good team. I have a good research cohort and I have a great staff support. So I can actually work with people and get things done. And, our job is encourage the young generation, the next generation, so they can work together and produce the high quality paper. So through their effort and your leadership, we can actually produce a lot of meaningful research, innovation, and clinical ideas. And which I think one thing that most young people are always trying to know, how did you do it? How did you actually find the time to do this? Whenever you treat a patient, whenever you read paper, or whenever you encounter with people, you always have a question. And like I said, whenever I teach, people ask me a question. It triggers me to think, what is there, or if I understand, or if I don't understand. If I don't understand, I will make a hypothesis and do a question and do an experiment and trying to answer that question. So through the interaction with many people and through the team effort, I think we maintain our publication high quality. That way, I think we can actually make an impact on the society and impact on perio and implant research.
Yeah, I mean, that's amazing because I always wonder, how do you even know how to ask the right questions? Most of us go through dentistry or go through life without asking the right questions and just do what is being told or do what is being taught. But you are always at the forefront of innovating and asking the right questions. And that I think your IQ, it's way beyond. And a lot of people are very, very smart in asking questions, but not necessarily be able to execute the research or the way to find answers. What makes you do that other than your team? And then do you just dream up the ideas or you sit at home because everybody's curious, how do you do it?
No, I think everybody has a question and including you and everybody does. It's how you put it in the action. We all have ideas and we all have excuses. And we all can say we are too busy and we don't have a time and we don't have energy, we don't have a resource. But if something's dear to your heart, you will find the time to do it. You'll find a plan, you'll find a resource to help you to accomplish that. And sometimes I even support myself to do a research, which I think if I want to know the answer, if I don't have the financial support, but that answer is dear to my heart. So I actually found several research myself.
Oh my God.
And then do it because I think to me that's important. That excitement and that happiness is not money can buy.
Yeah.
See, that's the difference.
I think that's a true altruistic view, and what you do from the heart is what a lot of people don't realize, and they just see the publications. And I think in dentistry, a lot of us are trained even as an undergraduate. You come out as a dental student, you practice as a dentist, you don't realize what people like you have done to make it possible for us to practice. And I don't think enough of us speak about it. That's why this podcast was so exciting for me and so important that we try to draw out why you do it. And those that shake the world of dentistry are people like you. You truly love perio. You truly love implants. And you truly love dentistry. Why did you pick perio and implants of all the specialties?
Can be a joke and it can be a truth. I was trained by oral surgeon, and to be honest with you, and they always think about I should be an oral surgeon. And when I come to the USA and I'm trying to apply the graduate program back in about 40 years ago, they usually don't take the foreigner to be the oral surgeon residency.
Or in the US
at the time. So I said, I love the surgery. I love the blood. So what can I do on surgery instead of beside the oral surgeon, which is a perio.
Yeah.
That's what I end up in perio specialty because we still do surgery. And I can actually use in some of my skill and talent to develop. So that's what I choose the perio field. So it's a lucky. And, when sometimes it's a lucky, it actually guided me through to know more because perio, it's very exciting because we not only teach you the surgical skill, we also teach you the science. And so you need to have a science and you need to also understand the biology in order to get better.
Yes.
So to justify your clinical skill and what do you do?
Yeah.
So, by accidental, I get into the perio and by accidentally, I'm doing a lot of perio and same things. When I was in the perio training, I have never done any implant. Can you believe it?
Yes. I
we,
know.
we don't have an implant at that time.
Yes.
So, once you have the foundation, I always tell young people, what is most important is not doing it, is understanding, have the good foundation. So you can adapt and adopt many new technologies. And I give them an example. When we are the graduate students, there's no computer. And what kind of computer now we have?
Yeah.
What kind of things we have? Do we learn that in the college? We never did. We actually evolve and learning along the way. And that's how life is. You learn through your career.
Oh, that's so inspiring because it's very true. Everybody wants to learn techniques, which is what's happening now in education, especially post dentistry, undergrad. And most of them are just trying to look and attend courses for techniques and skills. And unfortunately, what's missing is the biology and science. How do you make the young ones go back into science and go back into biology and really understand why you do something? Or why you do use a certain technique to treat the patient?
I think this is a very easy for some people to understand. What are the difference between the people who went to the training course in the residence program versus people who are taking continuing education courses? People who go into the taking the continuing education courses, they learn the skill, hopefully learn some biology. But if those who you spend 3 years to learning the science, biology, and background, which give them a solid foundation. So they know why this procedure works, why this incision should be cut here instead of there. But if you only learn the technique, you only see one person did one incision, the other person did the other incision. You don't know which one is correct. So every day you're going to looking for and searching for the new technique, a new idea or new approach. But if you step back, every procedure, their base is the same.
Yeah.
It's not different.
Yeah.
So I think I will kind of advise the young people, what lasts long is not a technique. It's biology.
Yes.
It's the science foundation. So you better have the science foundation. You can carry yourself for long enough to what you want in your career.
Yeah. That's so true. That's so true. I mean, I never knew the value of our residency training. As you said, I also got into perio by accident. And the 3-year was the real grounding of the science and the biology that allowed us to continue to evolve. And what you mentioned, that as you evolve through technology that's coming in, then you know what techniques to pick up, how do you do things, and what you need to learn at the same time. So I think that's a key message that we need to tell the young ones. But what if not everyone can get into a postgraduate program? And there are also many postgraduate programs around the world. And of course, you are the number one school in the whole world. How do you differentiate, and what happens if you can't get in and the base is different? I've seen them that the base is also different. Yeah.
I can give myself examples. I was trained not in the number one dental school. I was trained at Case Western. It's the same way. We are the dental school, a graduate program focused on clinical skill. But I always think about it's not the program, it's you who makes the difference.
Yeah.
If you want to continue ask a critical question and asking yourself, why do I do this? Why do I do that? No matter where you are, you're going to be successful. You need to set a plan, the action to help yourself. Don't feel better, say, I'm not in the top program. All the famous people may not necessarily graduate from the top program. We can see all the famous people, they never finish a college, but they're still very successful.
That's true.
So I don't think I'm not saying you shouldn't go to the graduate school. All I'm saying is, don't feel bad about you didn't get into a top school.
Yes.
If you have your mindset, if you have a dedication and focus, you can achieve the same things in a good school. They may have a better faculty, they may have better structures, but they need to have people who are dedicated, like you are, focus, can achieve things people cannot achieve. Then you will be the same.
Yeah.
No matter
true.
where you are.
No, that is so true, because a lot of us, some of them, and some of our dentists and colleagues, they feel inferior, or they feel that, oh, it's because I didn't have the chance. So it's almost as if the grapes is sour. But I always tell them it's not necessary whether you're a specialist or you've been trained the best way, but how you deliver and how you treat a case and how you feel for the patient is very important, and how you continue to learn. Like you say, ask the right question. Yeah.
It's also an example I can share with you. Many of the people I teach throughout my continuing education, they are not in a graduate program, but they are great clinicians.
Yes.
They learn and they train themselves, they put themselves in the effort, and they're learning from mistake. Don't worry. When you do enough, the time and the expertise will come. And I can tell you, I have many people now in different part of the world as the leaders, as the clinical champions, but they didn't finish the graduate program. They didn't go to graduate program.
But they went to your program.
They went to the course, but
went to your course.
I try to train them to think. That's all.
Yeah. No, but all of us are very lucky to have gone to your course, and that's why they are trained so well. Then that's amazing. So who inspired you and led you to focus on perio? Of course, that was accident, but who inspired you to continue staying in education after your training and go on?
I can mention about Dr. Nabil Pisada. Actually, my program director and chair is a Case Western. I know he was a top when I was a student. He always asked me and go to the library. I probably spend many evening, many weekend on the library to search for the things he asked me to do.
Wow.
And right now you got computer, you can type it and you find it. But before that time, we have to go to library, physically look for the book and then look at the literature. So
and it's awful. It's always like, in the attic and trying to look for the journals.
It's tough, but and I learned one things, because when they ask me to do some things, I go and search, I read, I get more knowledge than other people.
Yeah.
See, that's actually a step backward, which is a step effort you put in, you gain some things people didn't know. Because throughout all these interactions, and I learned a lot. So when I graduated, I remember Dr. Bisara told me, he said, you are a great clinician and also a great teacher. He said, if you go into the private practice, you're going to waste your time. But maybe you want to look into education. And the second person I actually appreciate a lot is Henry Greenwell, who passed away. I always think about my career, 50% is supported by him. He is a lawyer, and he also a periodontist and Air Force person. He teach me how to use a computer. But the key is he teach me how to be a better person, because I'm a foreigner. My English does not, like my daughter said, my English sucks. I didn't speak a perfect fluent English.
No, you published among articles. All right, it's way beyond. And
but
your English is so good.
So anyway, Henry was actually mentioned to me saying, he said, the more important for you is to put your thought together. And if you can express your thought well, you can move the needle. And I think that's the important statement he said. And he also helped me out throughout many of things I encountered in my career, like the early graduation from the program, and also helped me in getting my thesis done and getting my research groundwork done. See, he is like initial because I don't know anything which people always say the excuses. How do I know how to do research? How do I know how to do a statistic?
Yeah.
I know how to read, but you got to have some guidance, some mentor.
Yeah.
So one of the things I'm going to advise the young people and is find a good mentor.
Yeah.
A good mentor can save you a lot of effort and they can guide you through a right track and right path.
Yeah. That's so true. That's so true. And I think you've mentored so many superstars that it's amazing of how many people you have groomed. And despite the fact that you can't groom every one of them, you still spend enough time with the rest of us that we are, although far away, you reply. You have the speed of lightning and you are so disciplined. And a lot of this people don't realize and people don't know. And because I've dealt with you personally, you respond the fastest and you react and get things done the quickest. Was this innate in you to be so disciplined, or was it self-taught, or what was in you that drive you to even emails? You are on the dot.
I think it's a discipline, and because I was there before, I sent email to people and people waited for a long time, and not because that people didn't respond, but eventually I forgot to. So what I did is I actually has one things I do. I create a so-called to-do list. The things I needed to do for my personal, the things I needed to do for my academic, the things I needed to do for my responsibility. So I have the things I listed. And I refresh that list every 2 weeks. But one things I do is, we all have a limited time. And I don't do things that quick. But I will glance through my email every day. And I usually know when to respond. So generally speaking, if I want to respond to email, it's after my swimming. And I have more time, I can think through it. But during the swimming, I can think about how to respond because I already glanced through the email.
I see.
And very quick, but I don't respond. Sometimes I like to respond in the evening. So it's more quiet. I have a more thought process, then I can respond better. But if I didn't respond, I will make the note saying I have to respond. This is the things I have to do. And I will catch up that usually before the end of a weekend. So that's what I do. I do a lot of editing.
Yes.
And there are many things I have to do. So I have to make sure that people knows I have this due day. I have to finish. And same with the students' research. Your students always has these issues, which if they send you email, they want to right away.
Yes.
But if you want some things from them, they're going to forever. So that's what you needed to learn. But that's the things. The more you care, the more you respond. I got one student the first time. I asked her to do some things. She never does it. But whatever I work with her, I done with the same day. So 3 or 4 times later, I told her, I needed to see that every day because I never want to leave the things behind when I go home. Every day I go home, my slide is sold out. So people didn't believe it. No matter how many patients I treat, I sold it out. So actually I criticized my own surgery. I learned what I did today. So I sold it out.
And when your memory is fresh, because you look at the photos and you know what you've done and what you should not have done. You're a clinician. You have to look through research and you still have to teach. I was trying to ask you this question. How do you go through an 8-hour day or a 12-hour day or a 16-hour day?
No, if I ask myself, what do I do in a day? I can share with you. One thing I read the literature. They say if you go to bed at about 10 o'clock and wake up around 6, you got 8 hours sleep. You live longer. So I'm trying to ask myself to do that as much as I can. So I usually wake up around 6, and I get my breakfast. But in the morning, I don't like to read periodontics related. I like to do investment. So I learn the investment. I know what markets shift. So I learn a little bit what I want on the investment. Then, when you go to school around 7:30 or you stand to treat patient, then you have a very busy time until lunchtime. Then If I don't have a lunch meeting, I will try to sit down and think about the morning, what I did. If I have a lunch meeting, I go to the meeting, then I will leave everything to the 5 o'clock. And right now, because the swimming pool is far away from where the dental school is, I used to right after the school at 5 o'clock, I go swim. Now I usually finish all the email and probably around 6:30, then I go swim. Or I do it beforehand or after. It depends on the time and the load. If I need a sold out slide, so from 5 to 6:30, I sold out slide, and I go swim. Then I think about how to respond to email. Then I eat my dinner, and then I relax a little bit and chat with my kids. And basically that's it. And then after probably about 8:30 to 9, I can read the things I needed to read and doing the work I needed to do and respond to email I have to respond. And hopefully by around 10, I can go to bed, if not at 10:30.
I mean, when you're describing this, it sounds normal. I just want the audience to realize it's not normal because you are on the board of one of the biggest organizations, not just 1, 2, or 3 biggest organizations in the world. And you run the associations, you write the articles, you edit journals, I mean, there's no way anyone in this 3 lifetime. So the afternoon, do you pick and choose which one to do first, or is just to-do list?
No, you gotta have a to-do list, and it's a priority. You have a second. And eventually every Sunday you're going to catch up and get done. I still have a paper I needed to read to have a seminar to discuss with students on Monday. So, but that's the way. It's not difficult because I've been in the field long enough. So reading, it becomes easy to pick up. I don't spend 3 or 4 hours to read one paper like I used to. Now I can spend 30 minutes. I can read one paper, pick up a point, and then understand the pros and cons.
Yeah.
And so much easier that way.
Yeah, I think it's because you read it so much that it's so easy for you. So we used to stay up as residents. Crazy. I mean, literally we only sleep 2-3 hours and just to finish the papers, for lit review. And it was so tough. So that's why when I look at your CV and look at the amount of work they've done, I just say it is 3 to 5 lifetime for most people. It's not possible. You're almost like a superhuman being. And we all say that behind you. A lot of us all say that Prof Wang must be a superhuman being because he has 48 hours. We only have 24 hours. That's how we explain, and we explain to others. Now, coming back to education, one of the most difficult things for a lot of dentists is to get into a good program or whatever program. The fear is how to be selected. And obviously in the States, each program, each dental school, you might only take 2 to 4 residents per year. And this is competing with the whole world, everybody trying to get into a program. So how do you pick your residents? I mean, if you don't mind sharing, because I'm quite sure a lot of viewers will be wondering, I want to apply to Prof Wang's program, or I want to apply to University of Michigan. How do I train myself and prepare myself for this? Yeah.
It's a good question. Very good question. I think everybody asks me the same question. What kind of residents I look at? What kind of potential candidate I look at?
Because you decide who are going to be periodontists and who are not going to be periodontists.
No. I think there are other programs. There are other opportunities. Yeah. I don't think one program does not accept you. It's the end of your career.
Yeah, that's true. That's true.
What I think the unique things, you have to always make sure that you are different than other people. Every students come in to the interview, they always said, I'm the hard worker. I'm honest people. Which one is not hard worker? Which one is not honest? So what is unique of the hard worker on honest? But I think the people forgot. The interview, it's let people know who you are. What do you think you wanted to do? So you have to think about what can you do? What can you bring to this program? What are the difference? Not just hard working. What is unique talent you can bring to this particular program? And you also needed to give people the feeling you are hunger for the success, for the knowledge. I need to see the eye with hunger. I need to see the eye with motivation because that's the individual has a desire, has a motivation. It's going to be succeed because they already show it. I have a student came in. He just said, if you take me, I will bring the new one like a digital into your program because I have the experience on the digital field. I'm the AI expert. See, that's the difference. That's what people want. Not just saying, I have a good grade. I'm hard workers. Who didn't have a hard grade if you want to get into the graduate program?
Yeah.
And so I think for those of you trying to get into a top program, you have to ask yourself, what is unique of me? People will look at me different than other people. What separated me from other people, other candidates? And I think if you can figure out that, you have a shot in any program, not just the Michigan, but any program.
Yeah, it's true. Any program is already difficult to get in. Yeah, and well, that's a very good advice because I think in those days we were not. We couldn't find the answer. We just go in blindly for the interview and didn't know what we were getting into. But it was so scary. But it is one of those things. I think all of you are so lucky that Prof Wang has given you one of those biggest tips to get into a program as well. When you look at hunger, how do you discern? As you said, everybody say they're honest. Everybody says they're ethical. Have you ever ended up picking someone who you think you may have, due to their hunger and due to their hunger for success, they do things that may not be what, like you, to be so pure and ethical? I'm sorry, I'm asking a very, borderline question, but it is.
I think they do. They do. I think you're gonna see people wanted to do a shortcut.
Yeah.
That's the human being. That's human nature. And when we have a program, we have a top-notch candidates and people are very bright and smart. If they don't know how to cut a corner, then they're not smart enough. But I hope they don't do it.
Yeah.
But this is the people. Once in a while, you're going to see one or two is going to do that. And I always said, hopefully you don't see a lot. But we in the life, sometimes we make a mistake. That's what the mistake you do. Hopefully one day the individual can find out that's not what the right path to do. But, I always said, if you want to do these things, you hope everybody does not know. Unfortunately, everybody do know. So again, I'm always say, people always think about, I can get by this. The only person don't know is you, but other people know.
Yeah.
So I don't think that's the smart way to do. And, the students I train, they always think about, I cheat the list, I lie here. And then Dr. Wang probably don't know. The truth is we do. And we just don't want it to
confront it.
Confront it. And, we're just trying to guide you to the better way. We continue to using the guidance. We don't want to upset the student. We want to make sure they learn advance. So as the faculty, you want it to be mentor students. So you provide a good advice to guide the students to the right track. Yeah. And some people listen, some people don't listen. But the reality is this, is that people continue to lie or cheat. Their career is going to be short-lived because people is going to find it. And you're going to upset people and you're going to block your own career.
Yeah.
It's not smart.
Yeah.
It's not smart.
That's true. I think honesty and the true heart of being ethical is one of those things because in our field, it's so easy to do shortcuts and get away with things. And unfortunately, that is something that I will always feel. How do we educate that ethics? It's really hard to educate ethics between extracting a tooth or not extracting a tooth. That's simple in periodontics. How do you define that even? Or how do you teach your students?
I always say that if you think the patient is your mom, then you decide to take the tooth out for your mom, then I would say that's a right ethic. Because we all love our mom. So take your mom as example. If you treat your mom the same way like you treat your patient, then I think it's the right way. I don't know it's a right or wrong because we don't have the things to backtrack if I do this is correct or not. But if you think about you treat every patient like your mom, then I think it's the right approach.
Yeah, I hope so. I hope so too. Because nowadays we've got people that, everything it's advanced and quick. And I've just recently been shown a picture of, because obviously all this instant same day teeth, all on falls, all on acts. I've just recently been shown a picture of the anterior maxilla with the teeth and the bone all taken out. and then implants being placed. And I always wonder, and these are specialists, I always wonder, how did we end up in this day and age
I think this,
of
it's
dentistry?
unfortunately, this is a crossroad for many of us, because people who does that, they may have, I don't want to give the excuses, but I think some people may have a financial, which is a stress, and they needed to make quick money. And I think that's probably a quick money, but they didn't think about the consequences later on, which is unfortunately. It's not just dentistry. In all specialty, in all field, people has make that mistake. So I don't want to just single out the dentistry, but like I said, if you want to take the tooth out, if you're going to do the same things for your mom, I'm okay with it. Because you think the best for your mom is this approach. That means you've been trained, you've been told this is the best approach. Then to me, I can take that. But if you do it for other reason, then I cannot take it. That's all.
But we're getting training from people who just advise that first before even considering or understanding what other treatment options or what other technology are out there that we can improve the situation and not take the tooth out. So are we in this day and age, due to social media, due to everything else, they compare teeth to implants, and some say implants are better than teeth. What's that myth for the public and for dentists? What do you think?
I think there's a misleading quite often in the social media. They wanted to teach people, social media. If everybody knows the social media, you have to get very aggressive. Even take a knife to cut yourself and to get everybody to have to follow you.
Yeah.
But that's social media, because you need to be dramatic in order to capture the people's eye. For dentistry, how our job is, we're looking into a thing. We are art and scientists. We need to do the good work. We have a science background, but you swear to protect your patient, using your patient benefit. Yes, we may have a couple of bad apples, and we may have a wrong instructor try to teach you how to make quick monies, and hopefully not everybody. That's what I think. We need a better education. We need to have people to go out lectures, and we need to tell people what is social media, what is good and what is not. Because I see many social media is fake.
Yes.
So unfortunately, that's the way they do. They post the areas and this is right after surgery. But did they ever post 2 years after? They don't. Because it's the consequences that the things does not work. Look good does not mean they last longer.
Yes.
And I think the patient need to understand. So we need a better patient education. We need a better training course. We need to let people aware of that. The more public awareness, the less that type of problem can happen.
Yeah, I think that's the reason why we started this podcast, because half of it is for the public, and we hope that certain sections will attract the public. And in fact, we're lucky enough, we do have some patients already starting to follow us, but the message is we are being drowned. Like, the good people are being drowned in social media by a lot of marketing and a lot of messages that goes out there. How do patients even know? And I mean, we are trying to invite you to make sure that you will set the scene and protect us for the next 10, 20 years, I'm quite sure, with all the associations you are up there with.
It's a funny thing. I used to quite get upset about what social media does, what the patient getting the treatment wrong or getting the treatment not the best, we call the treatment options. But these days, I ask myself, what things can happen? It's like, if I go see a medical doctors, I may die in that chair.
Yeah, that's
okay.
true.
That's the reality. And I'm a Chinese. I'm going to use in the Chinese philosophy a little bit. I believe in destiny. What I believe in destiny, it's kind of interesting. If the patient decide to choose this doctor and get this type of treatment, that It's his or her destiny. They may screw up, they may fail, they may be disaster, but that's his or her destiny because he choose to follow the social media and get this type of treatment. So unfortunately, I'm not part of it. My job is continue to educate the public, continue to educate the new generation on dentists or periodontists to do a right thing, to do a right job.
Yeah.
And hopefully this type of a population will outweigh the people who are making harm.
Yeah.
And we all have the good people and bad people.
Yeah.
So hopefully there are more good people than less bad people. Unfortunately, that's the society. You have a good and you have a bad.
Yeah, that's
and
true.
I cannot control it. But my job is continue to promote the right things, the education, the science. And I don't govern the social media because they don't need a peer review.
Yeah, they don't. Anything can go up. Anything can go up, and that's the sad part. That's the sad part. Now, what would you have changed during this journey of coming to where you are? I mean, everybody will be dreaming to have your career path, but what do you think, if you knew what you are today, what would you have done differently when you were younger, or what do you wish you have changed? Yeah.
I was lucky. So if you ask me, would I change anything? Probably not. Because I think I've been blasting throughout my career. I do things and usually I get very much supported, not only the staff, the team, and the friends. I was lucky over my career. Do I do a different things, Lee? One thing I probably would say is I probably spend more time with the family. That's one thing if I want to say some things. When you're getting older, you will take more of your health. I pick up sports at late of my life. I should have picked up earlier, but I spend more time in trying to focus on my career. Now I'm trying to balance my life on the health. That's later. So if I can do early, I think that's probably more important. But sometimes you learn.
Yeah.
And so I won't complain. Yes, the things can change, but as long as you do your things and as you do things from your heart, I think it's fine.
Yeah. Coming to your family and your health, would you mind sharing a little bit? Because I've met your daughters and they are wonderfully, people, and they're super smart and super capable. How do you even have time, and how did you bring them up so well?
I think I educated my daughter in a correct and wrong way too. If I ask myself over the years, my older daughter, I was more harsh. I wanted her to be a number one student, and I put a lot of pressure on it. And then I started to realize all they want is a father who supports their learning, a father who understands what they want. So I then scale back and just being a friend. I'm not trying to be their teachers. I'm just trying to be their friend, be there to listen, to support. And I think they actually did well in that way. My daughter is all finished the college and they all do very well, as good job. And my younger one it's in a good university.
And she's a neuro.
They want to go into neurosurgery.
Surgery, yeah.
So, they all do well. So I learned it instead of trying to push them to mold them to what I want them to be, but just being a friend to support what they want to be. It's important.
Yeah.
See, I learned the ways throughout my life. I'm just be their friend. If they needed somebody to talk, I'll be there. If they needed some guidance, I will be there to provide it. So the best advice for all the parents, is be your kid's friend and be there for them when they need you.
And not be overpowering.
You got.
Because we are all type A personalities that we are professionals, and sometimes
we're trying to tell them what we want, not what they want. Do I have a medical issue? Yes, I went through, like I said, I forgot to take care of myself, and I should go to the regular physical checkup. And because I was too busy, I escaped, and then I forgot. And then you got the problem, and you actually take some time to take a rest and fix the problem. And you realize, life is short. When God needs you, they needs you. They don't wait. So, I learned it very quick, and, I need to take care of myself. Otherwise, nobody's going to take care of myself. So I started to pick up the exercise, and I did more regularly, more, we call formal and more structured, the way to protect your health. I do regular checkup, and, I do physical exercise. I just try to make sure I eat healthy, and, all these things we learned it from we got sick.
Yeah.
And if you don't sick, you always think about it will never come to me.
Yeah.
Once it comes to you, you say, I'm still a human being. It will get it.
No, I think, thank you for sharing, because a lot of people think that you're a superhuman being. And I wanted to share the other side of you, where you've been so successful, and we all have lessons that we need to learn as well with life. I have many that it's so hard, and thank you for giving me all the best advice especially the last 5 years. I cannot thank you enough, Prof. And I think the philosophies that you have are very critical in being successful and doing what you want. That's something that I wanted everybody to hear from. And it's not you're invincible, because when I was younger, when I met you, we were all so scared. We were saying, if it's Prof Wang, we're dead meat. Seriously, I think you know that. Right, with the American board examiners. So do you think you have relaxed now a little bit more with your students?
I think more. I think, over the years, you learn. And in the beginning, when you're young, everything's black and white. And now you get into more understanding, you're more supportive. We all getting older, getting wisdom. Now, I usually don't use and say you're getting older, you're getting more wisdom.
Yeah.
Means that, you're more white hair. So, you learn it.
Okay. Coming back to it, inspiring the young ones. For the young dentists, what advice would you give if they would like to specialize? And I've seen a lot of young ones now, they are very determined. The minute they graduate, they want to go into a program. And do you think that's a good idea?
For the young people, I always encourage, if you can afford it, if you have time, do it while you're young, because that's give you a motivation. You have energy. People always say, when they're young people, you have to explore, you have to find the opportunity for yourself. So I would suggest, you enrich yourself, and you're looking for opportunities. And that's the key you have. How do you enrich yourself? Means that you read, you attend the course, which is meaningful course. And not only dentistry. People always say, I only want to study dentistry. A lot of things you learn is not just dentistry.
Yes.
You need to learn other things, how to live, how to invest. These are things people always think about. I'm a dentist, I only do a dentistry CE course or continuing education.
Yeah.
No. You learn other things.
Yes.
And you're going to read other book.
Yes.
But that's where you balance in your life.
No, I'm having this problem of trying to tell the dentist that if you just like perio, you don't just learn perio, because I've just had this phone call this afternoon from somebody, one of the head of department of perio, saying that, my resident says that there's not enough perio in the program because they just want to learn perio. And I've got, you're missing the point, because we can't just learn perio and do good dentistry. So just like you say, we can't just learn dentistry and be good in our life. And we need to do a lot more. And I think we are in this world now with technology. We need to really unify dentistry and learn a bit of everything to ensure that we can keep up. And it has changed so much in what we do. How do you even keep up? Like you say, 40 years ago, there was no implants when you started. How do you keep up? And how do you evolve?
It's a funny thing. I learned it from my students. These kids or these students know more than you do. I have people who learn the new technology, the AI.
Yeah.
See, we have published many AI people. Young people will teach you.
Yeah.
They know. Then, the good things is that when they are getting excited that they're doing and they help you, and in order for you to actually talk to them, you have to read. So you force yourself to go and explore the things you don't want. And that's why you learn. mutually you learn from each other and
Mm.
benefit from each other.
Mm.
Then you move the level up.
Mm.
See, I was lucky. That's what I said. I have people who are hunger for the new knowledge,
Mm.
new technology,
Mm.
new skill.
Mm.
And, I'm part of it. And,
Mm.
and that's what I always enjoy to be a program director
Mhm.
because it keeps me young.
Yes, because the new ones come.
You got it. They always have a new idea. They always
younger.
have energy. Yeah.
We need to start recruiting the younger and younger ones. Yeah. No, but that's amazing because a lot of people just give up and that's not me, and not do it. What do you see in the future now?
I think if the future technology is going to govern many other things. What I see is a lot of a treatment plan can be done by AI.
Mm-hmm.
You can use an AI to read the X-ray,
Mm.
much accurate than you are. You can use an AI to read the biopsy report,
Mm.
much accurate than you are.
Mm.
You can use an AI to propose a treatment plan.
Mm.
Like I say, you can use an AI or smile design to design the procedure, design
Yep.
the smile. All we did, they can even use a robot to do a surgery.
Yes.
They're not for us. So I think the new technology is slowly coming, but we need to learn how to control, how to use this new technology.
Oh,
That's
I love the word. I love the word. How to control and use new technology. That was my next question. How do you control the technology? Technology is coming out left and right, and some young ones just think that the technology is good enough to do everything. And unfortunately, that's where the pitfall, because when you don't have enough experience, or like you say, you don't have enough biology or science training, you will be misled by the technology. So how do you
I think
fix
right
this
now
problem?
the people need to understand what's the limitation of the technology. That's what control it. Because the young people totally 100% believe in technology, which is a problem too. Because technology, they're learning from the wrong information, so they're going to give you wrong input
Yes.
or wrong output, whatever you look at. So I always said you got to have a basic knowledge to understand this is right or wrong.
Mm-hmm.
Otherwise, you're going to have a lot of problems.
Mm.
And today we have a lot of problems because we too much rely on technology. And
Yes.
then we got problems.
Yes.
For example, implant placement, whatever, because it's not so much accurate, but people still do it.
Yeah.
But do we going to give up the technology? No, we know the limitation. We can improve that, but we have to improve that to make the technology even close to perfect.
Yeah.
Okay, one day there will be, hopefully.
How long do you think we have?
I have no idea. Must be the next generation, beyond my life. I don't know.
I was hoping to hear that it's in this generation because University of Michigan has already got the answer.
No, not yet. We have the taxi now. It can fly in now, so it's not a problem. Soon everything can happen. You don't need to drive on the road. You can drive in the air.
No, I mean, when I use AI and I'm searching for articles, or let's say a lot of people are using that to answer questions even. And the problem, it can be misleading. So the young ones wouldn't know.
They
right?
don't.
So how do we fix this? It's I mean, that's
See,
the
the
101
AI has
question.
learning from somewhere, but depends on who puts the input.
Yeah, but the input people are not necessarily at your caliber or people of the right team behind it. So for the patients, they are also asking the AI, and they come with the question saying that this is what AI says, this is what the internet says, so I want this. And I'm going, you can't have this.
Yeah, but this is the things you have to explain to them, and you have to correct the results because there are many misinformation.
Well,
and unfortunately, the AI has a lot of misinformation, the wrong answer. They do. Yeah. So eventually, you need to continue to feed the machine to correct all this information.
So your brain will be something that we need to study, literally. Like if we can download that into the AI, I think we'll be at least 50%.
No. The Einstein has the
No, but I'm quite serious. This is a major problem. And I think around the world, for the patients and for us clinicians, it's actually getting harder to practice, and for research too, because research, literally AI can come out with the research and says that is saying this, and patients pull out. And I'm going, is that this article that I've never seen? And what journal is this? I don't even know. Yeah.
See, the things I think people has to understand what information you gather. You know, if I look at it as the editor of the journal, you have a Q1, Q2, Q3, Q4 journals. If you keep using the Q4 journal, the data, you're going to misguide a lot of people. The reason for Q4 is the lowest quality. So a lot of people has done the material methods wrong. The data was wrong. That's why it's a Q4. So you have to try to stick with the Q1. So eventually, I think the company knows that. They will actually feed the AI with the high quality paper, and you have to pay them some money. See, where it always end up with, if you wanted the high qualities, you pay for it. Or garbage in, garbage out. So that's the way you're going to end up. The company knows that.
The company knows.
But they needed to make sure that they can recover their expenses or investment. They're not going to continue to do these things for you. They're a company. They need to make money.
Yeah,
so
that's true. That's true. They're company. They need to make money. Yeah. But even with, I mean, maybe in a few years that once the AI gets better and more of us pay the companies, then maybe better quality stuff will come out.
I think right now you're going to see it. If we do a study in a good university, using a good data, good resource, publishing a good journal, that's going to feed into the new AI system. So that will slowly change it. Because right now, the AI coming from the small sample size, small data input. So that's going to be errors.
Yeah. Yeah, and it's quite scary because it is giving you data that, it's pulling out articles that you were never seen, and from journals that I don't even know exist. And
I can joke with you. One thing's related to myself. It's very interesting. If you type the AI into the sandwich bone augmentation.
Okay.
I was the one who developed a sandwich bone augmentation technique in 2004.
Yeah.
It's one of the earliest bone augmentation technique. But if you type a sandwich bone augmentation in it, they always go into we call the vertical bone augmentation on sandwich. It's totally nothing to do with my horizontal bone augmentation. So even though I was the first one to introduce that technique, nobody know who did it. So you will give to other people credit because the AI does not recognize it. So, I don't know how to teach the AI to recognize it. So to be honest with you.
Yeah, I think I think that's the issue with AI at the moment and with technology, and that's a very good analogy with like what you say. I would like to bring back to the fact that if garbage in, garbage out, that's very true even in implant surgery. The surgical guides, it's not everything. Yeah, and digital planning is dependent on who is planning and how you've planned it, and whether you have the knowledge to plan it and experience to know what's going on with technology as well as science. That's the part that I think a lot of us are missing, and the young ones don't necessarily get the learning curve of doing it without AI, so they don't see. So is there a way that we should fix that? Because very often,
I think the government is trying, especially in Asia or whatever, they want to mandate the people who take a certain training course before they qualify to do certain procedure. For example, implant therapy, because they noticed the problem already. The people was trying to rely on one thing, but they didn't have a basic knowledge.
Yes.
So unfortunately, I don't like a government control the education, but they may need it to be mandated eventually, because when you see too much problems, you got to figure out the solution. And that may be one way. I don't know. Hopefully the individual can learn it. So.
Do you think that's a good way? Because
I don't like a government control what we do. I don't think it's a right way. But I think the good way is the individual should improve themselves, learning themselves, so you don't make that mistake.
But with individual, like how do you drag? It's like in Chinese we call it, you can drag a horse to the river and give them the best education, but they don't want to drink the water. How do you?
That's called destiny. If I joke around, the people is going to be good, the people is going to be bad. Some people is going to learn it, some people don't.
Yeah, and I think I have to learn more from you to accept that some things are destiny and some things you cannot change.
There's a joke I had. I'm just joking, okay? That's no offense. One of my friends told me at one time, he said, everything's we born with it. It's God approved
Mhm.
because that's the God approved device. You have teeth, everything's.
Mhm.
Now, when the teeth extracted,
Yeah.
you put an implant in.
Yeah.
God didn't approve the implants yet. So that can be a problem because you can tell your patient that God didn't approve the implants. You put it. God only approved the tooth. See? What can I say?
I like this one. I never knew there was this story. We're going to have to share this story, because implants are being sunk every day. And it's how many millions, like few hundred millions now. And we have a major problem. And I think there's a pandemic as the AAP, the AAO, the EAO, all these big organizations around the world has identified that there is a pandemic. So the pandemic of peri-implantitis, and that's the topic that you've done a lot of research on. Where do you think it takes us to now? Because a lot of patients don't realize that placing implants, there's a risk and there are complications, and how do we fix it? Yeah.
See, the first thing you can say is God didn't approve the implant yet. So
I wish I could say that to the patient.
No,
God didn't approve your implant. Yeah.
It's a replacement devices. It's not.
Yeah, that's true.
So, but the truth is that the implant do have some problems, and the peri-implantitis becomes a pandemic. It's coming up, especially in the country who does the implant without following the proper treatment plan, proper training, proper location, proper restoration. So there are many of the we call the procedural paths you can make a mistake, and peri-implantitis is the outcome. So you're gonna see a lot of things, and people has to learn how to treat this. And there's one old saying now: is to save the tooth.
Yeah.
To save what God approved. So that's the key, because that still can avoid a lot of peri-implantitis.
That's right.
And you're going to see the pandemic swing back, try to save the tooth. Because we have a peri-implantitis. We lose bone, we lose tissue, we don't know how to correct it.
Yes. Yeah.
And that's a problem.
Yeah.
So even though I am the expert in the field, I just talk about it. There are things on the soft tissue. There are things on the hard tissue. There are issues on the restoration. There are issues on the patient maintenance. It's not one part.
Yeah.
It's everybody needs to chip in order to maintain the good implant health. So I need to place good implant. Then restoration has to be good and then the patient has to maintain it. That has a circle. It's not that it's easy. People think.
Yes. I think you've said it correctly, for patients as well. We all are a team to deliver the best work, and we still have not come to that. And thank you for being so honest that we don't have all the solutions yet. Do you think with the leading experts that you are leading in the world, do you think we can come out with some things that can help patients or dentists that place implants understand this is necessary before they even sink an implant into the patient's mouth?
See, we're trying to educate and make a patient aware of the peri-implantitis can happen and will happen in some of the cases. I place implant more than probably almost 35 to 40 years. Personally, I don't see a lot of peri-implantitis. I place my implant right, and I make sure my restoration was done well. And I make sure the patient come back every 3 months or 6 months to clean it, to maintain it.
Yeah.
So if I can do that, yes, this device may last long, but it requires all the coordination.
Yeah.
So I think the people who does not have a skill, who does not know that, they shouldn't. If a patient is not ready, they shouldn't. If a patient smoker, uncontrolled diabetics, that's going to be a problem. So
there's so many factors. There's 101 factors that we actually need to align before we do that. And I think patients all don't realize. And speed. Now it's speed. It's I want my teeth on the same day. I want everything on the same day. How do you let patients know that biology?
I joke around. How long will it take your mom to have you? It's a 9 months. It's not a 1 day. I can do everything in 1 day, but they come out the second day. So it does not matter. But the key is 1 day can be done, but it's the balancing occlusion. You can have it. But it's not as easy. Everybody can do it. So it's a challenge. So for those of the patient who want a quick fix, they are in the wrong camp. Because eventually who hurts? The patient.
Yeah. Yeah.
They know. I have many patients, they're crying
Mhm.
because they did the treatment, they all fail. They have no place to go. Where do they do? You know, people didn't see it, don't understand. But once
Yeah.
you see it, you feel
Really
sad
sad.
for the patient,
Yes.
and you don't know what to do.
Yes.
You cannot help.
Yes.
But the patient choose the wrong provider and did the wrong treatment, and they are suffering throughout their life, remaining life.
Yeah, remaining life. Tell me about it. Yeah.
That's sad. But patient don't understand, because once your decision make can have a last long impact.
Yeah. Yeah. Actually, we hold a very huge responsibility being a medical professional. And I think a lot of people think that it's easy. It's not easy, and it takes time. There's no quick fix solution. Yeah. And that's probably what we want the young ones to know. They always say, how do you know this? And how do you know that? It didn't come overnight. And I was young before and I didn't know anything, right? And we all have that, and it takes time. Yeah. So thank you for sharing the truth, actually.
You're welcome. You're welcome.
All right. Coming back to patients, and just for a little bit of public advocacy, periodontal disease, gum disease. As you say, we're trying to save teeth now. Do we have the magic wand to keep them, to regenerate?
Regeneration has advanced so much. We probably can say a majority, 80% we can save the tooth. Yes, maybe 10, 20% we cannot, but majority of the teeth we can save. We give it a try.
And then what happens? Do you think there are other factors other than periodontal disease? Because as my personal experience of practice now, I realize that gum disease is one factor out of the whole mouth, that there's so many other things that we need to control. What do you think makes it successful?
Everything's the same. For every treatment, you need to have all part in the equation. The patient's health, the patient's medical condition, the patient's compliance should be good. And the surgeon should provide the adequate treatment and a proper surgical approach. If you do a restoration, you should have a proper contour. So this is everything's in there. And you using the things like today we can use in biological agent such as growth factors with the understanding of debridement and the clean up of the surface and do a conservative approach or maintain the soft tissue in terms of the papilla, so we can have better regeneration. We learn that and we actually have the advancement in that field. That's what I say. The more you can actually improve your skill and knowledge and the material, then you can better keep the teeth longer.
So with keeping of the teeth, we have this issue now with a lot of people getting on aligners, getting on, aesthetic work. And of course, all of this creates a secondary problem for us as periodontists, because aesthetics and straight teeth are now the number one thing over gum disease health. And we see the side effects of a lot of all this. How do you think bite is important? Do you think aesthetics is important? Aligning teeth is important? Do you think, I feel that there is a bit of a miss between all our different fields, and we refuse to come together. And that's why we treat our own part and they treat their own part, like the orthodontists treat their own part, the periodontist treat their own part. And we don't seem to be able to work together, which is why we are advocating unified dentistry. Do you think that's a main factor in keeping the teeth in periodontally?
I always said the field of a dentistry, one of the important things is interdisciplinary approach.
Yes.
We cannot just do peri alone. You need to team up with the orthodontics, team up with restorative doctors, or even general dentists. If you have a team approach, you have to ask them, when I align the teeth, make it look straight, look nice, did I change the bite? If I change the bite, then that shouldn't be done. Okay? So the bite is still more important than trying to align the teeth. You can have a beauty, but you have no foundation. Then it ends up nothing. So you gotta have a foundation. So I think by working together, you can save the tooth. It may not be perfect, ideal look aesthetic, but at least they are functionable and not bad looking.
Yes.
I'm not saying it's going to be perfect at 1-to-1 or 0.1 millimeter perfect.
Yeah.
But I always say life is not perfect.
Yes.
And we're going to have a little bit here or there.
Yeah.
But overall, it's good.
Mm-hmm.
That's all we need.
I think it's all about good health.
Yeah.
And I think for patients, why I wanted to bring this up, it's because we very often patients go from one specialist to another specialist to another specialist and another specialist, or the GPs, and they get all confused. And we haven't up to today really defined our roles together. And we may go into a practice with 5 different specialists or multidisciplinary team, but the patients all see each of them individually. By the time it comes back, it's like, oh my God, something else, has happened. And that's where I'm trying to get to. How do we make sure that we, in specialty training program, you guys, we all have the treatment planning sessions together. This is often not happening in private practices. So,
see, if you go into the private practice or referral doctors or some group practice, they should have a group conference meeting to improve, to enhance everybody's knowledge and the learning how to work together. So I think that's eventually they should have it. Same way with a private practice solo. If you practice alone, if you work with people, take a phone call, talk to people to understand what the other side think.
yes.
You cannot just do it by yourself. You're like an ivory tower. You're not going to go anywhere.
Yeah.
So
yeah, because there's still a lot of solo practitioners out there that feel they can do everything.
Yeah.
And patients have this misconception all the time as well. So just coming back to social media, patients are now having a lot of data and a lot of knowledge from the internet. Which is the biggest misconception that you think we need to highlight now?
I think the misconception in the social media is usually they're showing the wonderful result, quick outcome. But the reality is that you don't get that type of result every day. The reality is that you don't get that things done in that short period of time. It does take time, and when it takes time, the body will say what it is. So they need to understand that whatever you see is not peer review. It's not being verified. It's only a showcase. It's like when you watch the movie, we don't jump out the 33 floor without dying. But if you can jump off 33 floor in the social media, you're still alive. So and I'm always saying, you got to understand what you look at.
That's a very good one. That's a very good one. Thank you. I think the movie because I've been asking these questions to a lot of our guests now. I can't get to the point of explaining that, yes, you're right. In social media, it's not peer reviewed. Peer review is scientific reviewed and with the right people. And maybe you explain, how do you get to peer reviews?
No, there's no way, because the social media, unless the government wanted to control it. But the social media, the reason is that they allow you to easy post. And that's why, they also have the one line, it's on your own responsibility to interpret the outcome or the expression. So, the way I go back again, it's just if a patient believes that's what's the destiny, what's the final, then nothing I can do, because he or she believes in that social media. He or she actually watch that social media. He deeply believe in it. He's going to go for it. And how many when they get a true result? Hopefully they learn it so they can apply and post in the social media saying that's not true.
Yeah.
See, the more people can post, that's not true, the more people can be aware of and less damage to the public.
How many of us are going to do that's not true to fellow colleagues? I think that's going to be very hard because the public cannot understand. You think there will be a day that we will have that?
There will be a day eventually. I think people, when you get enough problems, they will eventually do that.
Yeah.
You look into some people like, some people dislike. Eventually we'll see more dislike.
Yeah. Okay. Yeah. I think that's a wonderful description. I cannot thank you enough for doing this. And I told our team that we need to have a second session that go dive into science, because if I were to ask you on science, I think there are so many questions, and we would like our audience to also come up with a list of questions about periodontology, about implants, about research of what you've been doing. So that is what we want to know in the next session. But today, thank you for sharing your personal life and your journey. And it's been such an honor to have you as well. And I wore this in celebration, which I seldom wear, qi pao, because although we are Chinese, I'm Malaysian and you are actually originally Taiwanese and now American, Chinese. There was one phrase that I said, regardless of where we came from or where we were born, I think the deep, meaningful thing that we have all came together is the fact that you want to search for knowledge and want to do better. And that's how you've traveled all the way to America and worked with the very best, did all the right things and come out. And in the very end, it is not who we are in skin or in color or where we stay around the world. And that's why I wanted to wear this to signify and thank you that Prof Wang, despite where you came from and your humble beginnings, you've gone around the world and seen everything around the world and brought the world up and made it a better place. So thank you once again.
Well, thank you very much. Thanks, Dr. Chia.
No, you're welcome.
Thank you.
Prof Wang, this Dental Optimist podcast was named after this Dental Optimist and started since 1968. It was designed to make every day a little bit more joyful. And that's how we came to it. So this is a small little gift for you. It's in blue color, just to remind you that we all have to stay happy and we all have to find ways like how you never give up on research and how you never give up on education to be able to move the needle. And I think I've learned that you have moved the needle. We can never thank you enough in our industry to have done so much for us. I can never thank you enough of how you've inspired me to move on and continue to strive and do better. I think that's all what we need to do.
Yeah. Thank you very much.
No,
Thank you.
You're welcome.
It's an honor.
Yeah.
Thank you.